Before you watch this, just want to warn you, if you get angry easily, this might not be the video for you.
Some call them extortion. We want you to hear from those patients firsthand because you might face a medical facility fee even if you don't actually go into a medical facility.
And right off the bat, this sounds illegal. Imagine your gym charges you a facility fee on top of your regular monthly gym membership, except they do it during a month where you didn't go to the gym. You would be like, I didn't use the facilities. Why should I have to pay a facility fee?
I think it's a very shady business practice.
Wendy Ko's ordinary doctor visit took an extraordinary turn to collections. She says she scheduled a routine visit at this John Muir Health office in Walnut Creek, paid her copay, signed some forms, and met with her doctor for 15 minutes. But later, John Muir Health sent Wendy a surprise bill for $125 for a facility fee on top of her copay.
And I almost guarantee you that hospitals are doing this and sending it directly to patients because insurance will haggle the hospitals and have a certain amount that they refuse to pay more than. But patients generally tend not to do that. It's far easier to bully patients into paying a little bit extra than it is fighting with hospitals who have experience and lawyers and doctors and stuff that know what they are doing and as such will not have to pay as much. Patients, on the other hand, you send them an extra small bill on top of an already big bill that they're paying and they might not even notice. It's basically free money.
I didn't understand why they were charging me just to simply walk into the facility.
John Muir Health told us its facility fees cover a wide variety of expenses, such as nurses, technicians, environmental services, interpreters, security personnel, plus equipment, utilities, and maintenance.
Yeah, but that's just normal stuff that every business has to cover. The price of the service, whatever service it is that you're paying, should just cover that on their own. Imagine if you buy groceries. You go into Walmart, fill up your basket, you're checking out, and on top of the price of the groceries, they charge you a facility fee, and they say, oh, well, it's for the maintenance and the electric bill and the other utilities that we have to pay for. You would say, well, why? I reasonably assumed that those prices were all baked into the price of the groceries. Walmart buys the groceries and then they calculate how much it costs them to sell the groceries, and then they add a small profit margin on top of that so that they can continue to function as a business. It's very reasonable for you to assume that that is happening. This is obviously not to cover those. This is a sneaky way to try and trick people into paying extra without realizing that that's what they're doing.
Wendy says she was unaware of her $125 facility fee. There was no price of admission posted anywhere and no verbal warning at check-in. But John Muir Health said Wendy signed this form, agreeing to doctor's fees plus hospital facility services.
So there's nothing about the amount. There's nothing. It's just you're signing your life away, basically. They could charge anything.
And to be clear, hospitals absolutely do. They basically pick numbers out of a hat, and then whatever those numbers are, they just bill you for that amount and see how much you're forced to pay.
She refused to pay.
Good.
John Muir then sent her account to a debt collector. Wendy's not alone facing a surprise facility fee. Viewers around the U.S. are complaining to our NBC and Telemundo sister stations.
This is just totally wrong.
Valerie Timponi, near Chicago, did a video visit with a hematologist and paid her copay. She says Advocate Health later charged her a $60 facility fee for use of a specialty room.
Charging a facility fee for a video call with your doctor is a whole new level of scammy. They're not even trying at this point. Imagine Zoom started charging their users a facility fee. You would be like, these are video calls. What facility could you possibly be referencing? Also, if there are fees for facilities, shouldn't it be us charging the hospital because we are using our facility, our home for video conferences in order to make the hospital money? We should be the ones billing them.
How many times before you logged in for your video visit did they tell you you were going to be on the hook for a facility fee?
Absolutely none. No upfront disclosure. And it was quite upsetting. I could not believe the surprise bill after the fact.
We contacted Advocate Health and asked how it justifies a facility fee for a video visit. It did not respond.
Of course they didn't respond because they know that it's garbage. They just hope that nobody will take notice or fight it. They're hoping that people will either be annoyed and pay it or pay it without thinking, but they're not betting on anybody contacting the news because almost no one does that. The healthcare in America is so broken that people just kind of roll over and take it because it's always been like that. Nobody has known anything else.
That it banned surprise medical bills back in 2022. And yet here we are in 2025 with surprises. Turns out the No Surprises Act was designed to prevent surprise out-of-network bills. It doesn't address facility fees. The American Hospital Association opposes federal reform, saying facility fees are increasingly used to cover the true cost of healthcare.
Then just charge for the true cost of healthcare. I'm not opposed to things being charged. Well, I guess I am kind of opposed to the American healthcare system and the way that it's billing. But in general, I'm not opposed to things having a price that is increasing, and as such, they increase the price for the consumer. That's fine. This is different.
Some states have taken action, outlawing facility fees or requiring new disclosure. California has not.
Which is kind of interesting because California is usually the first to jump on the bandwagon of protecting consumers to sometimes an extreme degree. But looking at this list, it seems like a lot of states that tend to lean more conservative and as such don't like government involvement in these kind of things. But you've got like Texas is there. I think that's what Louisiana, Georgia, Florida, Ohio. I mean, and they're along with New York. If Texas and New York are passing the same laws, you know something has got to be done.
To help you avoid the jolt people like Wendy and Valerie are getting, we turn to patient advocate Lisa Berry Blackstock. She's a professional medical bill fighter.
There's so many people who come to me needing help.
Lisa says the way you set your medical appointments must change today. Before you walk into any doctor's office or join any video visit, ask about facility fees. Negotiate. Either haggle yourself or make your health insurer step in. And always demand an itemized estimate of your bill.
Yeah, like that's all well and good to do that, and probably everyone does need to be doing that, just being more proactive with how much money they might spend in a hospital visit. But the fact that this is becoming the patient's job to do is absurd. Imagine having to call grocery stores and ask if they're going to charge you a facility fee when you try to check out with your groceries. Why should that be on you to have to do that? If you apply the logic that it is up to the consumer to make sure they're not being taken advantage of by any given corporation in America, then obviously it sounds absurd. Like, what if I bought corn at the grocery store and then I receive a bill from like the farmer for the facility that he had to rent in order to store the corn on the cob? Like, that's crazy.
You need these things in writing, and that includes facility fees.
Turns out Wendy's paperwork states John Muir will give you an estimate, but only upon your request. Wendy says a billing rep refused to reverse her $125 facility fee. She told them she was refusing to pay on principle, even if it meant collections.
That's when I emailed NBC and said, this is what I'm going to do then. And I didn't have a response from them after I sent that email back.
So we contacted John Muir and her insurance, United Healthcare.
Of course it was United Healthcare. They are just such an unbelievably scammy company. They have the most denials of service of any insurance company. It's like almost 1 in 3 services that are requested, they deny coverage for. It is insane.
After we started asking questions, United Healthcare told us Wendy's in-office visit has been reprocessed and will be paid in full. We apologize for this error. Yeah. We asked what the error was, but did not get a response.
Of course you did.
Wendy's off the hook, but still frustrated and motivated to warn you.
It's just so shady that they have done this to people.
Because John Muir did ultimately send Wendy's $125 account to collections, we circled back with them. John Muir said it waived off the debt collector. Wendy's credit report should be clear too. John Muir said it does not send delinquent account info to the credit bureaus, in line with California regulations.
A fee implies that you are getting something additional. Like if you go to a fancy restaurant and there's a valet fee, well, okay, that makes sense, right? Because you are getting something in addition to what you would reasonably expect from a restaurant. You expect food and the price to cover the food. But if there's something extra, like a valet, and then you pay a fee for that valet, like that totally makes sense. That's very reasonable. This is literally just hospitals raising prices and hoping that if they do it really quietly, that you will just pay without noticing. And I would bet hundreds or thousands of people have been paying these facility fees without realizing it. And it's not just her that has had to deal with this. Facility fees are becoming more and more common. Basically what happens is there's a company that owns a hospital building, and then the doctors within those buildings are either independent contractors or they own their own practice and they stay there, pay rent, whatever. And this means each time you go in, you're interacting with 2 companies. The first company is the individual doctor that you actually see and they have their billing system. And the second company is the company that owns the hospital building or the facility. Do you see where this is going? That you actually have the care in. And so after you leave, both parties send you a bill, the doctor for the medical stuff and the facility owners for the facility fee. But again, imagine applying this in any other industry. Most businesses do not own the buildings that they operate in. Imagine going into a Macy's store at the mall. After you buy your clothes, you pay Macy's and then you leave. And then you get a bill from the company that owns the mall saying that you are being charged a separate facility fee for using the facility that is Macy's. You would say, That is truly insanity. I already paid for what I did, which was the clothes. And they're like, no, no, no. You used the facility. You walked around inside Macy's. Ergo, you owe a facility fee. And this is impacting real everyday people in significant ways because people cannot afford surprise medical bills that are sometimes hundreds or even thousands of dollars showing up out of nowhere.
Okay, this is another public service announcement from your very friendly but not so local dermatologist. And this one is about facility. The lowdown here is that facility fees are additional charges charged by a hospital if you are seeing a provider in a hospital facility. So if you're seeing a private practice doctor somewhere out there, they generally do not charge these fees. But if you go and see a doctor at a hospital, there may be additional hidden fees that you're being charged for, and they don't have to tell you that they're going to charge you these fees. These fees, hospitals claim, go towards paying all the additional expenses that go into seeing your physician at a hospital.
But that's just the price. If everyone's being charged for using the facility, then that's not any kind of an additional thing that you are being granted. That's just the cost of the service. The only alternative to this would be like seeing your doctor at a park so that there's no building or facility involved. I don't want to see my doctor at a park. I would like to see him in a building with air conditioning.
So the nurses' salaries, the maintenance people, utilities, etc., etc. They can range from $100 to a couple of $100. So if you get an extra charge for a facility fee, you won't be surprised if you do. You could ask around and see. Maybe it's cheaper to go see a doctor at an outpatient facility.
One, I will absolutely be surprised because it is the most garbage fee ever concocted. I'm convinced that healthcare executives just sit in large glass suites, twirling their mustaches evilly, trying to think of new ways that they can scheme innocent consumers out of a few extra dollars to boost their personal paychecks and try and get some extra money. Because at some point, this has to be intentionally malicious. There is no world in which this is like good, healthy business practice.
So I get a notice in the mail that I'm past due on a payment to the hospital. And I was so confused because we already got a bill a long time ago. It was like, after insurance, it was like $15, which sounded great. This was a bill for $611 that after insurance I owe $234. And I called and they were like, oh, it's a facility fee. This is normal. It always happens every time you go into the hospital. There's two bills. There's the bill that the doctor you saw pays for, who is a independent contractor who has their own medical billing system. And you have the hospital's bill, which is the facility fee.
Imagine that you order from DoorDash. You pay DoorDash for your food, the food shows up and you eat it, and then you get a bill from McDonald's later saying that you need to pay for the food. You would be like, no, I already paid for it. I paid DoorDash for it. And then McDonald's says, oh, no, 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 this is different. DoorDash charges separately from us, and because there are two parties involved with your food, actually, you have to pay twice. That would be insane if McDonald's started charging you facility fees for using the kitchen in which the food is cooked.
And then, of course, I go into it and I find out, like, this is a total scam. It's been going on, but it's been getting worse and worse and worse that everyone's being charged facility fees. And, you know, of course, I don't want to just, like, keep yapping her to this poor person, customer service person who, you know, they have to fight this battle every single day. And I'm just like, okay, fine. I haven't paid it yet, but I am really curious. Has anybody gotten rid of the facility fee? Is there any way that I could, you know, make this fee go away? It's the first time I've ever had to deal with this. Maybe I haven't looked into it too carefully, but $611 for sitting in the waiting room.
And I think this is probably something that you could reasonably keep fighting. I mean, you can contact news stations, you can contact your insurance company, you can fight it directly with the hospital. I did see a news article where someone had used AI to like draft letters to fight bogus charges from their insurance companies for like services that they refused to cover, or like extra fees from the hospital. And that actually worked out pretty well. So maybe that's worth a shot. But really the best thing you can do is contact your local representatives and tell them that, hey, you, the person, someone that they agreed to represent the best interests of, are being ripped off by faceless corporations who are just trying to make a quick buck off you. Thanks for watching.